Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're talking about golfer's elbow. So not the most commonly heard one, but still that elbow pain. So we're going to go over what it is and what you can do.
So hopping into our next PT Pearl, we just brought you tennis elbow. We're going to head to the other side of the elbow and dive into golfer's elbow. I really don't know why they named both of these after sports though. Yeah, so when we're talking into golfer's elbow, for tennis elbow, we were talking more about the outside of the elbow, or if you're on the thumb side of kind of your forearm. Golfer's elbow is going to be on the pinky side, or what we call the ulnar side of the elbow. And again, if you flex your wrist towards you, like
so bring your fingers towards your forearm.
Yeah, fingers towards your forearm.
The inside.
You can feel that mass on the inside of your forearm kind of get nice and tight. And that comes right from this little knobby thing. Again, that is a medical term that I use all the time. Little knobby thing on the inside of your elbow called your medial epicondyle has this flexor mass coming off of it.
Yes, exactly. So formerly known as medial epicondylitis, but we also know that it's not necessarily an inflammation state. So the epicondylitis is not so much anymore. So you could say epicondylosis. So that's more of just like general tendon overuse, degeneration, stuff is happening at that tendon, and now you're starting to feel pain, essentially.
Yeah. It's also called golfer's elbow, pitcher's elbow, again, because these ones are popularized because you'll have like professional athletes or higher level athletes. And I think that's how those names kind of leak into the mainstream, is like you'll have pitchers in different sports getting this pain on the inside of their elbow. Again, that's a similar area that a lot of pitchers have injury called UCL injury, or ulnar collateral ligament. That's where, if you've heard of Tommy John surgery, a lot of pitchers, like prominent pitchers, will get Tommy John surgery. But again, that also is just, we're overloading the inside of the elbow.
Right.
And so our discussion really always lies around why are we overloading the inside of that elbow, and how can we find ways to move more optimally so we're not just specifically using that area.
It's not that your body can't handle it. It's when the stressors then become too much because we're not utilizing other parts of the body, or we're only utilizing this part, and we might be also inflaming the body in general and causing degeneration of tissues in general based on what we're doing in our environment and our lifestyle changes as well, which also have a toll on our entire body as a system. The
inflammatory process isn't something that's really going on or present the whole time.
Right. It's not like you have specific swelling just right there.
Yeah. Like I don't play golf and like the inside of my elbow doesn't swell up and get all hot and red. No, we just have that achiness and that pain that really starts to set in every time after we get home from work as a mechanic, or working, typing all day. We might just feel some of that achiness and pain in our elbow. So again, what's happening, that flexor mass that we were talking about has a bunch of different muscles again.
All right, 5 muscles, go Dom.
5 muscles: pronator teres, flexor carpi ulnaris, flexor carpi radialis, flexor digitorum superficialis.
Ooh, okay.
And it's a small one, palmaris.
Palmaris longus. Good job.
Did it.
But basically, you don't need to know all of those different muscles. You just need to know that they're on that inside of that forearm. They cause flexion of that wrist, and they are your flexors that connect all the way into that common flexor tendon that we usually feel the pain on that epicondyle.
Totally. And same with all of our other tendinoses or processes where we get this degeneration of the tendon. We just get this disorganization of the collagen fibers that are integrated with the fascia in the area, integrated with the actual common flexor tendon that's in that area. And that's when we start getting that real disorganization chronically, that it's not working as optimally as it was right away. And that's where over time we'll feel that pain more and more set in.
Right. You know, it could be recurrent little micro tears that are causing that remodeling. And it could also start to go along the line of developing necrosis, calcification. We also get to take a look at what's happening along that nerve root that comes right there as well, or not the nerve root, but the nerve pathway, which is that ulnar nerve, right? And that if you hit your funny bone on the inside of that elbow, usually people, that pain that you feel when you hit that elbow is not pain from the bone, it's that you hit the nerve.
Ain't funny at all. Nerves are the things that perceive the pain, and anytime that we have a lot more tension or stress in an area, a lot less space, like for that ulnar nerve, it's running right by that flexor mass, right along the fascial plane, kind of on the ulnar side. When we say ulnar side, we mean pinky side. You know, that's the ulnar bone that comes all the way down and connects into our wrist. And that's why if we tilt our hand towards our pinky, or that's called ulnar deviation, and then flex it up, we're actually going to overall probably put a little more stress into certain muscles or the flexor mass overall.
Imagine a lot of repetitive tension, a lot of repetitive motion just happening right around that area. It could start to have some numbness, tingling. You're going to have some pain in that area. You might feel radiating pain down the part where your flexors are, so all those wrist flexors right on the inside of the forearm, and that's why that numbness, tingling can happen if it's affecting the nerve as well, which is something that we test for when we're looking at this as well.
For sure. And this one might even more so than tennis elbow affect our grip strength, because that flexor mass actually includes the flexor digitorum, or the thing that flexes our digits, our fingers. So our grip strength can really be impacted. And kind of similar to how we would test for tennis elbow, I mean, flex your wrist down towards your forearm and then try to resist. Does that irritate or aggravate more than you think it should? Again, another great way to test it out is just rubbing this flexor mass, kind of pressing into the tendon, pressing into those muscles there. Do you get a lot of tenderness just by doing that in a way that you either don't on the other side, if you're, not feeling any symptoms on the other side, or on the outside of the elbow?
And a lot of the times when we're doing these tests, like, you want to extend the elbow as well, because it's going to put a little more stress, and then bend in the wrist and kind of resist that way. And you can also do the opposite, where you could do a passive test, which is just extending the elbow and then extending the wrist out. And then that overstretch, that overtension on that area can cause some symptomatic pain and stuff that you might be feeling.
90% of these are not sports related. It's just people working out in their everyday lives, doing the same things repetitively, whether that is working with tools, typing, working with your wrists in this flex position a lot, because then again, you're not getting that extension and that lengthening of that muscle, which is where you said sometimes if people just straighten their elbow and kind of bend their or cock their wrist back to stretch the front of that forearm, that flexor mass, that can be aggravating in itself.
Right, exactly. And some of the jobs that they just pointed out was like construction, plumbing, carpentry, so we're thinking anything that's doing a lot of repetitive.
Yeah, like think about hitting a hammer, like you're constantly going from radial to ulnar deviation.
Yeah. And
a lot of the times you might specifically be pushing into that ulnar deviation and flexion, because again, we're also holding a tight grip on a tool or a hammer or something.
Exactly. So you're using that grip, you're using those flexors. Again, if we want to look at like what's kind of happening on that ulnar side, if that ulnar nerve is getting affected, is Tinel's test.
And that's basically just
tapping.
Yeah, Tinel's test, or you can do that over any nerve, especially superficial nerves, that meaning that they run near the skin. So kind of like tapping over your funny bone. If that's really sensitive, just by tapping along the funny bone or along the ulnar side, the pinky side of your...
all the way down toward the wrist.
Yep, down towards your wrist. And you get tingling or numbness sensations from that. That could be because the ulnar nerve is kind of getting entrapped in this flexor mass that's a bit disorganized and giving that nerve less space.
So then the treatment would go a little bit more nerve related based as well, rather than just focusing on the tendon, the musculature. We would be incorporating some nerve flossing, nerve glides, all of that kind of stuff, which we did talk about on another episode as well. If you guys want to refer back to
nerve flossing, it's great because once you learn how to kind of like gradually add a little tension into your nervous system, you can really affect a whole area or a whole line down along that ulnar nerve and realize, oh, that might be one of the reasons that I continue to perpetuate a little more tension into this area.
But so what do we do?
Shoot some cortisone into it or something like that.
The reason we don't say, oh yeah, go out and get that cortisone shot is because it weakens the tissues around. So it's going to have an effect on those tendons that we actually want to get stronger.
Especially long term. And, you know, again, some people will be at wit's end and say, well, I got a cortisone shot and it actually made me feel a lot better to the point that I could start doing some therapy. You know, we don't like to always put up a hard wall and say, no, never do this. Like, I don't think you'll never hear us say something like that. But again, a lot of those types of therapies are meant to give our system enough of a buffer so that we can start to do some of the things that might heal ourselves, like an application where cortisone or a PRP treatment or something like that could be great is we get that type of a shot and we have a really thought out, you know, therapy route or routine after that, where it's like, okay, I'm going to get this, you know, if it helps give me benefit for 8 days, a week, 5 weeks, whatever it is, I'm going to work into doing some of these exercises now that we're going to talk about.
You have to get movement back in. Yeah. That's essential, especially if we want to get back to our everyday life. Like you can, if you have access to this stuff, and that's the other thing about PRP injections, like this is all still so new. It's not very accessible. And so it's also not the treatments we're going to go out and say, oh yeah, just go get that, because it's just not, you know, readily available to
and it's
everyone.
Meant to help stimulate your body's own healing, you know, processes. It's not meant to do the healing for you. The other things that we always like to mention when you're starting, if it is really inflamed, just start with that active and passive range of motion. Can I get into that full flexion? Can I get into that full extension? Full extension with that elbow straightened? Can I put some overpressure on it? Is that feeling okay? Do I need to stay there for just a few days to help calm it down, to start putting load through that flexor mass and that common flexor tendon?
Exactly.
Once we feel like we're getting that full range of motion back, then we can start to load it a little more.
Even if you had your hand in neutral, grab around like the wrist complex and then say, okay, I'm going to stop it from my thumb moving down. I'm going to stop it from my thumb moving back. I'm going to stop it from my hand coming forward. I'm going to stop it from my hand going back. Like all of these different, or going down toward my pinky, going up toward my thumb. Those are all isometric holds, and my hand didn't move, but the pressure of where I'm resisting can move all the way around. And that is such an easy way to just start loading without needing any tools except your own hands.
Yeah. And then what we really like to talk about, especially when we start talking about reorganization of some of these tendinoses or these tendon processes, is eccentrics. And again, that's like you're starting with your fingers and your wrist flexed down towards your forearm, and then loading, and then slowly letting it down and out all the way into that stretched position. Starting into those eccentrics, a lot of the times we might be able to load in an eccentric phase before we start to go from that really lengthened phase with our wrist cocked back to flexing it all the way forward, loaded. That might be a little tougher initially. Yeah. So starting with the eccentrics, that's going to really help to put the right kind of load on that tendon to start and more so perpetuate that healing and reorganization process of like the collagen in the area.
Exactly. And then studies have shown, again, like 12 weeks of just working on eccentrics have helped to decrease symptoms and pain that having at that area, as well as increase grip strength. You have to work on your shoulder as well. It's a part of the picture as to what's happening at the elbow. And we talked about this in tennis elbow as well. We need strong external rotators at the shoulder. So think of like doing like a wall angel and kind of placing those forms back onto the wall, and then abduction. So the arm moving away from the body. We need strong, Dom like to say, snow angels.
Snow angels, yes, please.
Wall angels, whatever, the same thing. But that same motion, and think of that, like we talk about that a lot in rotator cuff injuries, which I believe is episode 4. We did talk about rotator cuff injury. So if you want to go back and listen to like how to really get that shoulder strong, because we have to look at the areas above and below when we're talking about the area of injury.
Totally. And then once we kind of work on this whole system, we look at the areas above and below, really getting back into those job specific duties.
Yep.
and finding out, okay, why did this happen in the first place? Because, I mean, often it's doing something like opening a pickle jar, but doing it for 8 hours straight every day, all day. Like, that doesn't really make sense to do in our bodies. So how can we find ways to work where we're able to take breaks from the thing that may have been aggravating or may have perpetuated the problem in the first place, to avoid from that happening again?
Exactly. And breaks can just mean like, okay, I'm going to take my body away from this. I'm going to do the opposite motion for a little bit, whether that is a stretch, whether that is a movement, whether that's opening up the entire back, the chest, the wrists, the shoulders. Like, again, it's not just the area that is affected. It's working, making sure you have good wrist mobility. Also done a podcast on that, making sure you got good shoulder mobility, upper back mobility. So working the entire complex so that we ultimately keep the area healthy.
Again, it doesn't mean you have to do less work in the workday. It's actually proven that if we give ourselves a 5-minute break every hour, we're going to be more productive during our working time. And during that 5 minutes, or I like to say, give yourself a minute every 30 minutes to stand and go in the opposite direction.
Exactly.
Open up your chest, get up against the wall and do a pec stretch, do an open book exercise, whatever it is to get that body moving in, like you said, an opposite direction of how we're positioned. Because generally, if we're working with our hands a lot, some of these jobs that we listed in construction, doing stuff like mechanic work, a lot of the times you're hunched forward over a car, or working construction, you're always going to be kind of in that forward rolled position, even just, of course, sitting at a desk, stuff like that. Give yourself a minute every 30 minutes or 5 minutes every hour to open up. Thanks for tuning in again to hear all about golfer's elbow and what you can do about it. If you heard something you love, comment below. If you have more questions, also let us know so that we know what episodes we should bring to you in the future. Subscribe, do all the things. See you next time.